العلا FM.
Welcome everybody, our dearest listeners at your favorite afternoon show, Let's Ride. This is Ghadeer, and as I promised you, today we're having a very, very special interview where we get to know more about the topic of the day, which is skin care. So today we have with us here on the line, Dr. Omar Fouda, where he is a consultant plastic surgeon specialized in facial rejuvenation. Welcome to the show, Dr. Omar.
Thank you very much for having me. Good afternoon.
Actually, we're so glad to have you. And me personally, as a female, we always look forward talking about these things to get to know more information. And especially that we are we already started the summer season. So we actually have a lot of questions to ask for you, Dr. Omar, if you don't mind.
Of course.
So, Dr. Omar, first of all, can you tell us a little bit about the main steps that people need to do during summer when it comes to skincare?
So, good afternoon, everybody. I think the most important thing in summer is to try to protect yourself from the sun as much as possible.
Mm-hmm.
Summer is a season where people, like to get tanned. They get more sun exposure. It's usually an outdoor season. And the cumulative effect of sun damage cannot be taken easily on the skin. When we talk about skincare, we're talking about daily routines, and we're talking about a lot of preventive measures. And the aim is to delay as much as possible and slow down the aging process.
Mm-hmm.
So people love tanning because of the look that it gives. Some of them knowing, but many of them not knowing that it's probably one of the worst things that could happen in terms of making your skin look older sooner.
So, doctor, when we say this, beside the face, we know definitely it really changes the way your face look. But even for our bodies, like if I tan my body, not my face, it still do the same effect?
So it's the same. The fact that the face and the hands are more exposed throughout the year.
Mm-hmm.
So that's the cumulative effect of sun exposure shows more in the on these areas. Most people will find themselves having a bit of a darker shade of the same color on their exposed areas, the face and the hands, versus the rest of the body. So the covered areas are usually at least 1 degree lighter. The skin behaves the same regardless if it's on the face or on the skin, on the body.
Mm-hmm.
Sun exposure thins out the face, shows wrinkles, reduces the collagen, causes pigmentation, and that applies everywhere.
Mm-hmm.
Now, I'm not saying for people to stay indoor all the time, but there are a couple of things that we have to make sure that we don't do.
Okay.
That we can talk about at least, or minimize at least, because the problem with the cumulative effect of sun exposure is that it doesn't show in 1 year. But many studies have followed people over years, and you can easily see between siblings, twins, the changes that the sun does over time. And not all of them are reversible, and that's the issue.
Okay, so if we can have like basic tips toward having a better skin, what would they be?
So sun, SPF, so creams, you're going to go in the sun morning, an SPF, for what we call a sun protective factor,
Mm-hmm.
above 40. That's a must. There are many on the market, many brands. Some of them are for oily skin, some of them for less oily skin or dry skin. You want to avoid sun between 12 or between 10 in the morning and 2 in the afternoon, where I'm just focusing the talk on skincare in the summer. A lot of other things, of course, that we can talk about, including reducing smoking or not smoking at all,
Mm-hmm.
because that affects as well the skin. But if we want to talk about really the summer season, usually we don't like taking care of the skin in a way that exfoliates the skin a lot, because when you remove the outer layer of the skin could be more prone for pigmentation. So the summer is not the best season for using heavy exfoliants or heavy peels,
Mm-hmm.
because of the risk of pigmentation. If people want to do that because of whatever reason in their life, you want to make sure that you don't expose right away to any sun, because there's always a risk of pigmentation.
Mm-hmm.
So that's basically how we take care in the summer. Now, dry areas, dry climates, you want to moisturize the skin. But these are the basic steps, basically, to make sure that you can enjoy some of the sun, but without actually damaging your skin.
Perfect. So, doctor, well, actually, there's a lot of questions that we want to ask, but we're going to go for a short break for 2 minutes. We're going to listen to Never Be Lonely, and then we're going to get back with more information.
Sure.
Let's ride. We're live
on العلا FM.
Welcome back, ladies and gentlemen. We're still talking about one of the most important topics ever, skincare in the summer and in general. And to continue talking about that, we have with us here on the phone Dr. Omar Fouda, consultant plastic surgeon, specialized in facial rejuvenation. So welcome to the show, Dr. Omar.
Thank you.
So we were just talking about how to take care of your skin within the summer season, which is very important for everybody, actually. And now let's just talk about skincare I would say in more general way. What do people need to do to have a better skin in general?
So if we don't focus to talk about the conversation about the summer, usually a couple of things that are important. People have to know their skin type, okay? Because some people tends to have more an oily skin versus a dry skin. I would say the 3 or 4 basic skincare techniques is that one we spoke about is a proper sunblock in the morning, a night cream that has an exfoliant to protect or to rejuvenate or to replenish the outer layer of the skin at night. A moisturizer during the day. I would say the only treatment that really protects the skin or improves the quality of the skin that we do in clinics is Botox. So that's, there are a couple of other ones that actually renew the skin for people who have skin aging, but I'm talking about a prophylactic or something that you can do to prevent future problems. I would say the only one or one of the few ones we can do are early doing Botox. So these are the things that we do usually that we advise people as a base. Now, if you go to any skincare clinic or a skincare product, if you see any skincare products, you'll find a lot of other stuff being promoted.
Yes.
And they're useful, but depending on the skin type. Out of all the many types of products, we have vitamin C, peptides, the list goes on. But if you're talking about really basic skincare,
yes.
So we don't get very fancy, these are the steps that I just spoke to about.
That's interesting.
Now, when it comes to people who have issues, we can treat issues. So what I just spoke to you about were basic preventative measures. So we want to prevent facial aging. We want to prevent problems. Now, what happens if people come to us with problems? Problems being pigmentations, thin skin, wrinkles, and the list goes on. And now these can be treated, each one depending on what they are. So, pigmentations have daily routine to prevent or treat and have certain at the clinic procedures that we do. Some of them are the regular peels and some of the lasers. The fine lines, we have ways to prevent them, we have ways to treat them. Some of them are daily routine, some of them are at clinic procedures. The issue with aging that we just spoke to you about and the issue with smoking is that the skin becomes thinner. As the skin becomes thinner, it starts becoming wrinkly and saggy. And there are ways to improve the texture and improve the thickness of the skin. There are procedures that can be done in clinic. There are daily creams that can be used. And there are the surgical procedures that can be done. So all the treatments are divided into daily routine, non-surgical medical treatments that you just do and go home right away. You do under some sort of a local cream or local procedure. And then the surgical procedures that are aimed at more of an advanced age rejuvenation.
Okay, so talking about that, when do people need to have surgical procedures? Is it necessary from the first place? And who would be the best candidate?
So, this is a very general question. Because is it necessary? It's in the eyes of patient wanting them. Most surgical procedures they focus on lifting saggy skin. That being in the eyes, we call these blepharoplasty, people who have droopy upper lids and lower lids, or have puffiness in the area because of fat protruding, because of saggy tissues, either saggy skin or saggy connective tissue under the skin. There's something called vartosis, when the eyebrow falls down or you want to lift them up. And of course, in the early 30s, people start seeing some signs of aging, and this is what we talked about before, about preventing that or delaying that as much as possible.
Yes.
The signs of aging include heavy folds, so what we call the nasolabial or the smile folds or the sadness folds around the mouth.
Yes.
And a bit of excess jowls or excess skin that happens around the chin, and finally in the neck area. So if you take the face from top down, every structure in the face with age can start slowly sagging down. And we are between either excising some of them, depending on the area, like the eyelids, or lifting them back, and we can do that in the brow area, in the mid-face area, or in the neck area. Now, of course, I'm describing I'm summarizing the whole facial rejuvenation in a couple of words, but this is basically the basic tenets of how we bring back what time, age, sun, smoking have changed in people's faces.
Wow. So basically, as you just mentioned, doctor, so it depends on the eye of the patient, her or himself, to choose to do a surgical procedure or not.
Of course, I mean, we don't promote, or I know we should never promote surgery as the first solution, because it's not. We started the conversation about the preventative measures, how to delay the aging, and I think if people understand the importance of that, or really understand the importance of that, and how much time they can buy before needing or requiring surgery, they would take sun avoidance very seriously. I mean, most people will talk about around 10 years, delaying aging for around 10 years, because and that's just only by preventive measures. And that's pretty serious when you talk about, a woman in her 30s, but looking, a woman in her 40s, but looking like she's still in her 30s because she took care of herself in the last 20 years.
True.
And then for the majority of people, between their mid-30s to their mid-40s, as long as there weren't any major fluctuations in weight, most people in this age group would require some sort of a medical and non-surgical intervention, because they start seeing some lines, they start seeing some aging features in their face, and they don't like that, of course. Even men now don't like that, not only women. And those are the candidates for either skin treatments, so surface treatments, for pigments, for peels, for fine lines, for pores. So these are certain treatments like microneedling and etc. Or heat-based shrinking devices that basically do affect the amount of saggy skin to a limited degree, around 10 to 20% improvement in the sagginess of the skin. And those are maybe some of the listeners have heard of the high focus ultrasounds or Althera or Endolift. All these are just examples of devices that are aimed to tighten the skin a little bit.
Yes.
And then, of course, there's the Botox and the fillers, because people, with time, they lose some fat in certain areas of the face, and you want to minimize the wrinkles by doing some Botox in certain areas. And then at some point, depending on the person, somewhere between the 40s and the 50s, sometimes it's earlier, depending on the genetic composition, depending on weight changes, depending on a lot of exposure to the sun or smoking or other factors, people would require surgery at some point if they want to keep the look. Now, the issue is that, it's in the eye of the patient. Some patients like to age to look appropriate for their age, which is what we aim for. We aim for a very natural result. So, people in their 60s shouldn't look like they're in their 30s or 40s, because it's not real. But if they can look well and they look young and fresh for every age group they're in, that's the aim.
Yes.
And the majority of people, that's what they request.
Exactly. Well, actually, we would love to thank you for all the great insights and information that you have just shared with us, Dr.
Anytime,
Omar.
my pleasure.
And actually, we're looking for more interviews with you to get to know all the great things, because this is like one, this is one topic. But when we talk about skin and, all the self-care that you should dedicate to mainly to your face, we will not stop talking about it. So thank you so much for your time, Dr. Omar.
My pleasure.
Thank
you for the opportunity. Thanks a lot.
Thank you. So, ladies and gentlemen, that was with us, Dr. Omar Fouda, and he is actually a consultant plastic surgeon specialized in facial rejuvenation. So, what a great insights, to be honest. And yeah, we should take care of ourselves, ladies and gentlemen.
العلا FM, the sound of Arabia.